Hi everyone, my name is Dr. Augustine K. Bala from the International Christian Medical Fellowship. We're back again this month of April. We're talking about malaria and Shaka disease. So our first awareness is on malaria. We are adding our voices to the medical community globally as we create awareness and talk about malaria this month. Uh, Malaria probably is, many people in certain part of the world are very familiar with that term malaria, and some people may not know what is malaria. But malaria is a potentially life-threatening disease. Potentially life-threatening disease. It is actually caused by an infection with a Plasmodium protozoa that is usually transmitted by uh, female Anopheles mosquitoes. Yeah. And so the plasmodium that causes malaria, the plasmodium protozoa that causes malaria, there are different species of it in different countries. They have the most prevalent species that causes that. And so you have the Plasmodium falciparum, Plasmodium viva, Plasmodium malaria, Plasmodium ali, Plasmodium uh, no, let's see, right? And like in Africa, especially West Africa, like Liberia, Plasmodium falciparum is the most prevalent ones, and Plasmodium falciparum is actually the one with poor prognosis. Yeah, and in many countries in Asia, the Plasmodium knowledge is actually the most prevalent one, like in Malaysia and other places. Uh, well, that's malaria generally, right? So, what is the burden and what is the statistic, the epidemiology about malaria that we think is important to talk about it, create awareness about it? Actually, according to the recent data from the World Health Organization, half of the world population was actually at risk or at risk of malaria. Half of the world population is at risk of malaria. That's one. Second, we from the recent statistics from WHO also says that 247 million people got infected with malaria in 2021. Just 1 year alone, 247 million people got infected with malaria. And out of that 247 million people that got infected with malaria, of that malaria cases, estimated 619,000 died. 619,000 died. So that's a huge number, right? And so again, there are a lot of countries around the world that are actually malaria free. Like for example, China is malaria free. But yes, there is a risk of imported cases because people travel from Africa or Asian countries as well. And so there is the risk of imported cases of malaria. Well, you may not want to talking about imported cases of malaria, you may be thinking, well, that's not COVID, but yes, we're talking about 247 million infections and 619 deaths. That's really, really high. In fact, according to the statistics as well from WHO, 95% of the cases of malaria is found in Africa. Yeah, and 96% of the death as well is in Africa. But yes, that's not Africa alone. Asia is ranked second when it comes to the malaria cases. About 19 countries in Asia have increase and high rates of malaria cases. Countries like India, Indonesia, Malaysia. Yes, these countries are also in Asia and they are high malaria cases low as well. And so it is a global issue. I think this month as malaria, we want to add our voices to the medical communities and the public health people as we talk about malaria, because every sector of the health system will definitely um, have an impact if this disease is not controlled as well, right? So, uh, malaria can cause cerebral malaria, it can cause meningitis. Definitely, the neurologists and neurosurgeons will get involved with that. And so, it's not just a public health issue, but I think that's the beginning to solve all of those major medications. So, one out of verses to all the awareness that will be going around this month as we talk about malaria. With join my colleagues as we talk about the different fighters like the causes, the care, and prevention. We want to say, welcome. We hope that our awareness on malaria can be a blessing to you. Thank you.
Hi there, my name is Dr. Victoria, and I'm a member of the International Christian Medical Fellowship. And this month of April, we're here to talk about malaria, to spread awareness of malaria. And I am here to talk about the symptoms and signs of malaria. So let's get started. So some symptoms of malaria include fever. It also can be described as a flu-like illness, like shaking, chills, excessive sweating, headache, muscle aches, and you just feel really tired. You may also experience vomiting, diarrhea, kidney failure, liver failure. Some might experience seizures, coma, mental confusion, and etc. So, as you can see, malaria is pretty severe, and the symptoms are also not comfortable. So, if you do experience any of these symptoms, please reach out to your closest doctor or PCP, primary care physician. So you might ask, how soon can a person feel sick after they get bit by a mosquito? So for some people, my symptoms might start 10 days to 4 weeks after the infection, although they might feel sick as early as 7 days, or even some might even take it up to a year. And you might say a year. Well, that's because malaria has two stages. It has the liver stage and the red blood cell stage. So in the red blood cell stage, the malaria parasite can actually remain dormant for a long time. So it's only after these parasites leave the liver stage and then invade the red blood cells is when the person becomes sick and starts experiencing all these symptoms. We also say that malaria has cycling symptoms. The symptoms might alternate between 6 to 24 hours. You might have a time during the day where you feel really, really bad, high fevers, headaches, tiredness, and then it kind of goes away, and then it comes back again. So we call this cycling symptoms of malaria. I hope this portion of the video helped to educate you about malaria, and stay tuned to the end of the video. Bye now.
Hi everybody, so my name is Dr. Faustin Mambulu, and I'm talking to you all the way from China, and I'm going to speak or talk about, the main cause of malaria. You actually have 4 types of malaria, or 4 causes, and then it's all caused by the same mosquito that we call Anopheles, and that mosquito is what we call a carrier, that is carrying malaria from one patient. It bites the patient, it takes the disease or the parasite to get off the blood, because the mosquito Anopheles need blood to feed, and then one is feeding it. Within 1 week, that malaria will develop inside the saliva of the salivary gland of the mosquito, and later on, when the mosquito will bite against somebody else, they will end up having symptoms, or shall I say, they will end up being infected by that specific parasite that we call Plasmodium. So we have 4 types of Plasmodium. The first one, which is the most common one that we will focus today, actually there are 2 which are very common one, but the first one, it infects at least 53% of the patient. It's called Plasmodium falciparum, and that is the most common one and the most dangerous one. It's the most dangerous. Why? Because it actually infects the brain, not only the red blood cell, but also the brain, and it causes so much damage in the body, really bad. So we have treatment for those. As my colleague, we will talk about the treatment. We have treatment ways to treat those, but those are the most common, and they are the one that we have to watch. The second one, which is closely related to this one, is Plasmodium vivax. Vivax, why? Because that one actually somehow find a way to remain in the liver. When they stay in the liver, they remain dormant there for months, so you find somebody who was infected, got better, get infected again. Like somehow you left, let's say you were living in Africa, or let's say in sub-Saharan, maybe in India, and then you left there, and then later on, you get infected by malaria in a country where there's no malaria, because that malaria was within the liver. And that's the second type. And the third type and the fourth type, they're not really that common, but then we still mention them for completeness sake. It's Plasmodium ovale and Plasmodium malariae. So those are not really common, but then we still mention them. So thank you so much and stay safe out there. God bless you.
Hi, Dr. Anan here of the International Christian Medical Fellowship. And today we are creating awareness on malaria. As my other colleagues have already talked about the epidemiology, the signs and symptoms, I will be talking about the diagnosis of malaria. So in diagnosing malaria, your doctor would want to know some relevant history, such as your travel history, your past medical history, and some information that would lead to the diagnosis of malaria. Would also want to do a physical examination on you, check for splenomegaly and all that. Then we order for the labs. The lab, we can also do the antigen-based rapid diagnostic test, which is simple and fast. It can tell whether the person has malaria or not. Then the gold standard is the microscopy, where the thick and thin films are done to detect the malaria parasite and the quantity of malaria parasite in the body. From there, the doctor can treat. Thank you very much. Shalom.
Hello everyone, my name is D. Naomi Flomo, and I will be talking about the treatment and prevention of malaria. To eliminate the parasite, prescription medications are used to treat malaria. The kind of drug and duration of treatment may differ based on exactly what kind of malaria parasite you have, how severe your symptoms are, your age, or if you are pregnant. There are several commonly used anti-malaria medications. Chloroquine phosphate. Chloroquine has been the recommended treatment because Plasmodium is susceptible to the drug. However, the parasites have developed resistance to chloroquine, and the drug is no longer effective in treating malaria. Artemisinin-based combination therapies, or ART, is a mixture of multiple medications that have distinct effects against the malaria parasite. It is a standard treatment for chloroquine-resistant malaria. Doxycycline and mifloquine and etc. are used to treating malaria. To prevent getting infected by mosquitoes, you should take these steps to minimize your risk of contracting malaria. To protect exposed skin from mosquitoes, use mosquito repellent. If you are outside at night, dress in long sleeves and long pants. Use a mosquito net over the bed and install strip